I have been recently hearing that a lot of pushback against palm oil. Is palm oil is really bad for heart disease?
Not really. If it is consumed as a part of balanced diet, people are watchful what they are eating, then it does not directly lead to coronary artery disease or heart attacks or heart diseases. But yes, any oil, if consumed in excess, whether it's olive oil, soybean oil, desi ghee, coconut, palm oil, any oil which if it is consumed in excess, definitely it is likely to cause an additional risk factor to causing ischemic heart disease.
When you say ischemic heart disease, it can cause blood clots in the blood vessels supplying the heart.
It doesn't cause blood clots. It causes the buildup of atherosclerosis, the plaque. The blood clot formation is another process, how it forms.
How do you explain atherosclerosis to a layman, a person listening to this podcast?
There are two kinds of cholesterols in our body. One is low density lipoprotein, LDL, which we say is bad cholesterol.
Correct.
So, but it's not actually bad. So, what is the role of LDL? LDL's role is to transport cholesterol from liver to the peripheries.
Liver to other tissues.
To other tissues like hands and legs and muscles.
Correct.
Anywhere. HDL's role, the high density lipoprotein, it carries cholesterol from peripheries to the liver.
Liver, correct.
So if more cholesterol is deposited in peripheries, it could be heart vessels, it could be brain vessels, it could be limb vessels, it causes deposition of small cholesterol particles there. Also, in addition, it causes deposition of platelets, calcium, multiple factors. And once a small factor is deposited in the wall, it increases on its own. It self-regulates, auto-regulates its own formation. So the built-up of plaque is faster in people who already have tendency. That tendency is important. If the vessel wall has tendency that the plaque will build there, in those patients, it is more likely to cause problems.
So you're saying that the increase in cholesterol intake or increase in saturated fat, the concern was it may be lining the blood vessels, increasing the cholesterol deposits.
Yes, that was a concern, that it lead to increasing in LDL. But that increase in LDL is subjective. How will it cause? To who will it cause? Whether it will affect or not. So a patient with triple vessel coronary artery disease who has all the three arteries blocked, we have several of these patients who do not want any...
I'm sorry, educate the audience. What is triple vessel?
So in our heart, heart supplies the whole body. Heart itself needs some blood. So there are two coronary systems. Coronary is heart arteries. Two coronary systems, one in the left, one in the right. The left side again has two branches, major branches, left anterior descending artery and left circumflex coronary artery.
So two blood vessels on the left side, one big blood vessel
on the right side. Yes. So these three coronary arteries mainly supply the heart. So if there is any blockage in one, it is called single vessel disease. If the blockage in two, it's called double vessel disease. If the blockage is three, it's called triple vessel disease. So all three vessels clogged, more than 70% is a significant triple vessel coronary artery disease. Significant is more than 70% blockage. Triple vessel is all three vessels. Coronary is heart vessels. Disease is blockage. In patients with significant coronary artery diseases, all three vessels blocked. A patient who is not a surgical candidate. A patient who cannot undergo surgery for one or the other reason, whether his health is not permissible, whether he cannot afford it, whether he cannot access it, or whether he doesn't want it.
When you say, I'm so sorry, I'm just trying to break it down to simple terms. When you say not a surgical candidate, so when all the three blood vessels are blocked, the next step is to actually do a surgery to bypass that blocked vessel.
There are multiple treatment options available. First is medicines. That is called guideline-derived medical therapy, guideline-directed medical therapy, GDMT. Second is if we can do balloon angioplasties or conventional angioplasties, coronary angioplasties. Angioplasty is putting a stent. And then third option is doing a bypass surgery. Bypass surgery can also be done through several ways. Traditionally, it was done through open chest. We used to cut open the sternum, split it wide, do a bypass surgery. These days, it is done by robotic technology. We don't have to do all this. We make small holes, take arteries from within the chest and do the bypass surgery. These are several treatment options. But what we discussed first is guideline-directed medical therapy. If the person is not a candidate for surgery because of multiple other comorbidities, that the surgical risk might be high. If the patient doesn't want surgery, the patient cannot afford surgery, even though it is available through several government schemes also. But many a times, because of rush, because of family factors, he cannot go for surgery. And it is not accessible, although accessibility again is increasing, but it is not accessible and he cannot get a surgery. So would the person not survive? The answer is again doubtful. We are not sure whether he would not survive. If we do lifestyle modifications, if we give him medical therapies, there are several patients who have shown increase in heart function, not decrease, increase in heart function just based on medicine, lifestyle changes, and adequate attempts to keep themselves safe. Like avoiding any strenuous activity in the first few months, taking medicines regularly, having balanced diet, keeping cholesterols to normal limits. So normal limits is important. Normal limits is guided by the majority of population in that area. Same thing what applies to me might not be same for you. Because we come from different regions, we think differently, we have different genetics, we have different environmental factors. So all this, even with triple vessel coronary artery disease, which is a life-threatening situation for many, patients do survive with lifestyle changes, balanced diet, and taking care of themselves.